Introduction. Rabies, a fatal disease of all mammals caused by neurotropic lyssaviruses, is typically transmitted through the saliva of an infected animal, usually via a bite. In the United States, rabies is considered zoonotic, meaning it's regularly found in more than 20 bat species and in 4 terrestrial reservoir animal groups, which include raccoons, skunks, and foxes, each with their own distinct virus variants, as well as the small Indian mongoose in Puerto Rico. Historically, dog-mediated rabies virus was widespread in the U.S., but this variant was eliminated through mass dog vaccination and stray population controls, along with oral rabies vaccination of coyotes that had become carriers of this variant. Despite this success, potential human exposures to rabies continue to occur, with approximately 60,000 people receiving post-exposure prophylaxis every year. In 2022, there were 3,579 confirmed cases of rabies in animals, out of approximately 85,000 tested, with the majority being in wildlife but also including over 200 domestic cats and over 30 domestic dogs. Unvaccinated domestic animals are a known risk for rabies transmission to humans and other animals, and the transportation of unvaccinated or rabies-exposed domestic animals can facilitate the spread of rabies virus variants into new geographic locations. This article reports the identification of raccoon rabies virus variant in a stray kitten in an urban Midwestern city that is considered non-endemic for this virus variant. Study design. The primary focus of this report is a case study of a stray kitten found in Omaha, Nebraska, which tested positive for the raccoon rabies virus variant, or RRVV. This particular variant is not typically found in Nebraska, where bat variants of rabies are more common, and the south-central skunk variant is limited to the western half of the state. In Nebraska, from 2018 to September 2023, only a few cases of rabies in domestic animals have been documented, with most being the skunk variant, a single bat variant in a dog, and some not being variant-typed. In Douglas County, where Omaha is located, the last reported cases of rabies in domestic animals were over 40 years ago, in 1980, in a cat, and 1981, in a dog, with no other wild mammals except bats and skunks having tested positive since that time. This case of a stray kitten testing positive for RRVV in September 2023, approximately 850 miles from where this variant is normally found, prompted a multi-agency public health investigation to determine the source of the virus and to prevent additional spread. This case study highlights the role of veterinary practitioners in the detection and reporting of a non-native zoonotic pathogen and emphasizes the importance of considering rabies as a differential diagnosis in animals with compatible clinical signs, especially those of unknown vaccination status or exposure. The study involved testing the kitten's brain tissue for rabies, sequencing the virus to identify the specific variant, and then implementing a wide-ranging public health response. The response included extensive animal testing, vaccination, and public information. This was all done under what is known as a One Health approach, which takes into account the interconnectedness of animal, human, and environmental health. Results. The case began on September 22, 2023, when a stray kitten was found in a residential neighborhood and taken to a local veterinary hospital, where it was observed to have pupils of unequal size. The kitten, an intact male domestic shorthair, approximately 6 weeks old, was considered unremarkable upon examination, although a full neurological exam was not completed, and the unequal pupil size was not noted again at that time. The kitten was alert and responsive, ambulating normally, and reactive to stimuli. A small area of hair loss on the back of its head and fleas were noted. Initial diagnoses included ringworm, allergies, or flea allergy dermatitis. A test for feline leukemia virus, feline immunodeficiency virus, and heartworm was negative, and no other diagnostics were completed. Given the differential diagnoses, the owner requested treatment for ringworm, and itraconazole was prescribed. The kitten was then given to a new family on September 23 for adoption, but by the 24th, it began to show signs of illness, including ataxia, seizure-like episodes, vomiting, and diarrhea. The kitten was described as becoming agitated during feedings. On the 25th, the kitten was taken to a veterinary emergency hospital and was found to be quiet, ataxic, and hypothermic with a body temperature of 34.4 degrees Celsius, or 94 degrees Fahrenheit. Though a nervous system evaluation was noted as responsive at that time, photographs shared by the owner revealed unequal pupil sizes, which can be a clinical sign of rabies infection. The kitten's skin and coat were noted as normal. It was treated for intestinal parasites, and clindamycin treatment was considered for toxoplasmosis, and then the kitten was discharged with instructions to return the next day. Upon representation on September 26, the kitten's temperature was noted as being even lower at 33.6 degrees Celsius or 92.4 degrees Fahrenheit, and the kitten's condition had worsened. Clindamycin and heat support were initiated. However, the patient died on September 27. The clinician had discussed rabies with the owner due to the kitten's neurological signs and very young age and recommended submitting the brain for rabies testing. The brainstem tested positive for rabies virus via direct fluorescent antibody assay on September 28 at the Nebraska Veterinary Diagnostic Center, or NVDC, and given that terrestrial rabies is uncommon in domestic animals in Nebraska, the state public health veterinarian requested that the NVDC sequence the virus to determine the variant type. The virus was identified as raccoon rabies virus variant on October 4, and this finding was confirmed through additional sequencing at the Centers for Disease Control and Prevention, or CDC, on October 6. This was the first ever report of the raccoon rabies virus variant in Nebraska. Figure 1 of the article shows a photo demonstrating anisocoria in the kitten, a common clinical sign of rabies. It's presented as a close-up shot showing the pupils of the cat's eyes to be different sizes, and thus serves to demonstrate what that particular clinical sign looks like. Discussion. This case highlights the importance of including rabies in a differential diagnosis for neurological patients, particularly in stray animals, or animals with unknown vaccination status or exposure to wildlife. Rabies should also be considered in animals that have bitten or scratched people, or veterinary staff, even if the risk of rabies is considered low in that area. This can help ensure that life-saving medical care is provided in a timely manner. In this case, the decision to test for rabies resulted in initiating post-exposure prophylaxis for 10 exposed individuals and 7 exposed pets, and the variant typing results led to an emergency public health response. Veterinary professionals are key in rabies prevention and control, being the first to evaluate the animals, recognize clinical signs consistent with rabies, pursue post-mortem testing, and educate clients on the importance of vaccination. The initial clinical signs of rabies can be nonspecific, including anorexia, behavioral changes like aggression or hyperexcitability, ataxia, and progressive paralysis, which can last for a few days before progressing to severe neurological decline. Other manifestations can include excessive salivation, anisocoria, or unequal pupil sizes, and lack of appetite. It is noted that rabies should be considered in animals that present with these signs and have potential exposure to wildlife, whether that is a known bite or scratch wound or something as subtle as indoor bat exposure. The source of the kitten's exposure in this case was unclear. However, the area of hair loss could have been a heel bite wound rather than ringworm. Other possibilities include transmission from the mother cat, either in utero or through non-bite saliva exposure. Being aware of potential bite wounds can lead to more careful handling procedures. It is also important to use appropriate biosafety and personal protective equipment, particularly when handling stray animals or animals too young to be vaccinated. Rabies should not be excluded based on age, and even though there can be a prolonged incubation period of months in some cases, it can also be as short as a few days. Animals are not infectious until a few days before onset of clinical signs and pose a risk to veterinarians, veterinary staff, owners, volunteers, and other pets. Identifying animals that are a rabies risk early in the clinical progression allows staff to take proper precautions, reducing the risk of exposure. Animals with unknown rabies vaccination status should be kept separated from other animals in shelters or homes. The identification of raccoon rabies virus variant in this kitten resulted in a multi-agency public health response, with the Nebraska Department of Health and Human Services, Douglas County Health Department, CDC, USDA, Nebraska Game and Parks Commission, Nebraska Humane Society, Nebraska Department of Agriculture, NVDC, and Nebraska Wildlife Rehab all involved in the effort. This response included veterinarians, wildlife biologists, epidemiologists, animal control officers, and laboratory personnel. 10 people received post-exposure prophylaxis and over 750 raccoons were vaccinated parenterally, while also more than 18,000 oral rabies vaccine baits were distributed across Omaha to help prevent spread. Over 500 animals that were found dead, or found acting strangely and then euthanized, were tested and all of them had negative results, including raccoons, skunks, feral cats, and other species. The pets that were exposed in their homes, which included 3 dogs and 4 cats, all previously vaccinated, were booster vaccinated within 96 hours and then monitored for 45 days, without any resulting infections. Sequencing and investigation suggests that the kitten, or its mother, was moved from an area where this variant is zoonotic. Translocation of animals with rabies has been seen in rescue animals, zoo animals, and wildlife, and emphasizes the importance of responsible animal transport, which includes vaccination. Although there are highly effective vaccines for both animals and people, rabies continues to be a threat to human and animal health. Antemortem diagnosis is considered unreliable and the clinical signs can be nonspecific or mimic other diseases. Initial rabies diagnosis does not provide information on variant type and many states do not have funding or capacity to perform variant typing routinely. This case of a stray kitten emphasizes the risks posed by stray and unvaccinated animals, as well as the translocation of young, unvaccinated or pregnant animals, particularly those with unknown exposure history. Rabies can affect any unvaccinated mammal, old or young, with or without any obvious signs of exposure. Veterinarians are on the front lines of public health, not only taking care of animals, but also educating owners about zoonotic diseases. In this case, the veterinarian's astute recognition of rabies helped protect exposed individuals and animals, and highlights the vital public health role veterinarians serve. This case underscores the crucial role that veterinarians and other experts play in what is known as One Health, collaboration and zoonotic disease prevention and detection. It also reminds us that despite advances in rabies prevention and control, rabies exposure should still be considered when animals present with neurologic decline, unknown exposures, or unknown vaccination status, especially if people or other pets have been bitten, scratched, or exposed to saliva. From VetNeuroJar, keep those minds inspired, hearts light, and tails wagging.